IABDM, the 25th Gala Anniversary meeting here in Carmel. We're inaugurating a new era, and we're going back to where we started at Carmel Mission Inn. Is everybody enjoying the environment? It's kind of nice, isn't it? So this is my welcome to you and my farewell. As your president, I will be discharged in about 15 minutes, which is great. But here's really our reason for being. We want to, as biological dentists and physicians, leave the world a better place, leave a future for our children that is better than what we found when we arrived. And a combination of primarily dentists, but also MDs, DOs, and NDs. And what we do is technical. What we do is scientific. What we do is real. And it matters for people in their lives. And it all started with a simple idea that Ed Arana had about, we must preserve this concept of biological dentistry. We must explore this concept. We need to make it better known and more available. He was our founder, 1985, through his untimely passing in 2004. Dr. Bill Glaros took over as president 2004 to 2006. As he says, he kept the wheels on the bus after Ed Arana's passing and held it together, grew the membership, and kept the faith. Dr. Mike Margolis then followed for another 2 years, emphasizing organizational liaisons and helped get CME credits. Dr. Nick Meyer, for a shortened period of time, which we're going to correct in the future, worked to improve our website, instituted the mini meetings that brings us many new members and new skills, and he took the lead in developing a plan for international expansion as we enroll lots of other dentists. Here's your first physician president. Some are hoping he'll be the last. I started robust and healthy, as you see. Then I got sheared by my contact with all the dentists. What can you say? What's the state of our union? It's just fine. It's getting better all the time. The mini meetings have been absolutely spectacular. They really allow us to gain skills, have the opportunity to interface very closely one-on-one, and really up the level. We've got to up the ante on this because, still we're dealing with regular dentistry. We've got to be a whole lot better than that. MercuryUndercover.com. Go to that website, MercuryUndercover.com. Elizabeth Hong and Daniel Montoya have put together this awesome documentary. It will be in distribution soon with pay-per-view. It'll be available on DVDs for us and our patients as soon as they figure out the distribution system. 2 of your past presidents and several of our friends and speakers are featured on MercuryUndercover.com. We spent time in the last couple of years working on the World Mercury Treaty, the United Nations effort in order to control what's going on in mercury elaboration into the world. We've become more and more toxic, and that effort has been largely led in this country by our friend Charlie Brown with Consumers for Dental Choice. We are having a phenomenal input to the treaty discussions. Dr. Don Ewing and Dr. Bill Glaros and I have been meeting with the mayor's office in Houston. We're working on getting mercury separators, just separators, into the dental offices. And Dr. John Sefcik has been in Austin working to get fluoride removed from the city water supply. We are advancing. It's been slowly, but we are ideally positioned as baby boomers are coming into our era, literally. Obamacare is going to challenge the very fundamental understanding of how we deliver care and what care is delivered. The economy is definitely in our favor because people simply cannot afford to be sick. It could be a deadly choice. The world environmental awareness, especially with regard to toxicity, scientific advances, new dental schools, integrative medical approaches, the tide is in our favor. So we are ideally here. We've done a website upgrade. We're in the process of finishing that. It's going to become incredibly more useful for us. We've made some vital contacts with IAOMT. Dave Warwick here has been really a lead in that for us, and we appreciate your work on that, Dave. We've been exploring various strategic alliances and partnerships, including Dental Justice, including Immunotech, folks who offer for us really unique opportunities. And we're looking for the best ways to educate dentists, doctors, and the public. Three distinct groups, and to gain members who want to master the concepts of biological dentistry. We're making quiet efforts, I might add, to bring the ADA to the table, not to their knees. Very important that we understand we're all in this together. We're not separated on this. A group of your leaders have met with Robert Sherrick of Legacy Transformational Consulting. And that's, again, thanks to the contact that Dave Warwick made for us. And we are designing a strong future for IABDM. We are literally the dream team for all of us. We sit there and say, what's unreasonable? What could we possibly do? And then we're working on making that happen. There is a special private seminar coming with Robert Sherrick in February. It's open to members of our groups, and I would encourage you to look for that. Our IABDM Bold Promise is by 2015, we're one of the most sought-after healthcare organizations, transforming the standards of care in dentistry and medicine. And we've been holding our seminars sometimes on ships. And we have clear sailing ahead because that's where our seminar with Robert Sherrick is going to be. So I would encourage you to look for the February cruise. The crown jewel is that we're looking to be certified. We are starting all the processes of examination to be certified, but now there's a really bigger job. Not only do we get to say we're certified, but we have to demonstrate the skills, the abilities, and the knowledge to deserve that certification. Carol Vanderstrip has done a patient-oriented book called Mouth Matters that interrelates the concepts that we espouse in biological dentistry and biological medicine: inflammation, infection, immunity, hormones, cardiovascular changes, and so on. An absolutely wonderful way to introduce the public to the idea that actually what's going on in your mouth relates to what's going on in your body, and vice versa. And this is how we're going to help trap the doctors. You know, the doctors are a tough crowd. But so are the dentists. You know, we've gone far beyond drill, fill, and bill. We've gone far beyond in our understanding of the relationship of the mouth to better health. The confusion is that someone who says they are a mercury-free dentist is not necessarily a mercury-safe dentist. And our job is to show that the safety is for all concerned, including the dental hygienists, the dentists, the chairsides, and so on. It's a big job. It almost looks like hazmat. In fact, hazmat almost looks like outer space. And when you look at this, you go, what does that have to do with anything? It has to do with Roswell, 1947. Those of you who are laughing about whether Roswell happened need to know that my dad is having his 94th birthday today. Thank you. He's here. He's here, and the reason I brought up Roswell is because he flew the B-36 for the Strategic Air Command. He flew B-29s with SAC. He was a deputy in intelligence at Roswell when the saucer crashed. So if you want to talk to a human being who actually held the pieces of the saucer, my dad is one of the few still living. His boss was the one who went out and gathered the stuff up. Now, he can't hear you, but he'll smile and nod anyway. That comes from lots of instructing in airplanes. But the deal is that if you really want to talk, I think, with too much massive mercury exposure, too much cigarettes, too much alcohol, too much high-altitude flying, whatever, he's still made it this far, and he has some entertaining stories. So if you want, you'll see him carousing around here and there. And now it comes to the toughest part of my job, which is the transfer of duties. Our next president is Dr. Blanche Grube, and Blanche is unfortunately not with us today. She has had a personal urgency, and she will be our president for the next 2 years. Following that, Dr. John Sefcik. Following that, Dr. Nick Meyer, who will do a full term for us. In fact, we've already outlined his duties so that for the next 4 years he can be preparing for that. Our success is due to our members, our speakers, our meetings, our services, and our staff. The members always put their shoulder to the grindstone. They are doing a wonderful job, and that's the way it helps get us forward. The speakers, we always have the best. Why not? We deserve it. Our meetings are collegial. We get together and we talk about what really matters and how to do things. Our services are beyond compare. Dr. Don has done an awesome job collating various past reference materials, making them available on DVDs, making us really look at media for the future. And we have an incredible debt of gratitude to our Casper, our friendly ghost. That's Toby Ewing, who's our assistant ED. You never see him around. You never see him around. He's just always there. So it goes without saying. What's that? I was going to, and I couldn't figure out whether. Anyway. But it goes without saying, And enough cannot be said often enough that the spouses who are supporting our leaders have given dearly of their time and energy as well. So please accept our heartfelt thanks. And last, but certainly not least, here's what IABDM could be, which is nothing. Just nothing. Without the tireless efforts of Dr. Dawn Ewing, our executive director, who is our chief petty officer. She makes sure everything happens and happens right on time. So happy 25th anniversary, IABDM. You well deserve it. Let's look for another 25 years of joyful expansion. Thank you very much. It's been a pleasure. Dr. Blanche, you made it to the meeting.
I heard you say that I wasn't here, but that's not true. I know part of me is not here. For those of you that don't know, I lost 80 pounds. Some of you not count my 80 pounds. I lost 80 pounds. And